Hey everyone, this is Dr. Israel with Integrative Kidney Institute, and today I'm going to be talking to you about the latest edition of Research and News, May edition that came out today. So let's do this. All right, so as you know, we look into multiple medical journals looking for the latest research and integrative medicine approach to kidney health, and we know your time is valuable, so we summarize them for you in this edition. All right, so this first study looked at lifestyle interventions for kidney disease progression. And this is what we call a systematic review and meta-analysis. A meta-analysis is a study of studies. So basically, the researchers looked at several studies that looked at the impact of diet, exercise, and other lifestyle interventions on the risk factors and the progression of kidney disease and quality of life. They analyzed 68 randomized controlled trials in individuals with chronic kidney disease, and 24 studies were on dietary interventions, 23 were on exercise, 9 were on behavioral modifications, and 1 on hydration. 11 studies involved multiple components. They found that lifestyle interventions resulted in improvement in creatinine, in 24-hour urine protein, in systolic and diastolic blood pressure, and body weight, and in the quality of life of kidney patients. They did not find any improvement in estimated GFR for some reason or another. I don't know why, because if you have improvement in creatinine, you should have improvement in estimated GFR. But for me, if they don't find worsening of estimated GFR, that's good enough. So the researchers said that the improvement in creatinine was not really clinically significant. But if you look at the average improvement in creatinine was 0.43 milligram per deciliter. To me, this is good enough improvement and is clinically significant. So the meta-analysis said that exercise interventions resulted in the greatest improvement in estimated GFR and creatinine, and dietary interventions were best for decreasing protein in the urine and systolic blood pressure. So moving on to the next study, this is actually a review article. And it talks about IgA nephropathy and the immune abnormalities in IgA nephropathy. This is for professionals who are interested in learning about this. There is this 4-hit hypothesis when we think about IgA nephropathy. IgA nephropathy, as we know, is the most common primary glomerulonephritis in the world. And this 4-hit hypothesis suggests that there are 4 hits that lead to the development of IgA nephropathy. The first hit is increased circulating levels of abnormal IgA1. And then that will lead to an immune response, so the body will form autoantibodies against this abnormal IgA1. And these autoantibodies binds with the abnormal IgA, forming immune complexes. And these immune complexes ended up depositing in the kidneys and causing inflammation. So it is presumed that the site of this abnormal production of IgA1 is in the Peyer patches in the guts, in the mesenteric lymph nodes. No one knows why patient will start producing this abnormal IgA1. However, the interplay between genetics and environment may play a role. We believe, though, that environmental factors such as dysbiosis, infection, viral infection may trigger the formation of abnormal IgA1 in genetically predisposed patients. This review article is very insightful. It talks about the innate and adaptive immune mechanisms involved in IgA nephropathy. So if you want to learn more about it, it's a free access article. I'll put the link for you down in the description. And this is a picture of the 4-hit model in IgA nephropathy. This is taken from an article, so we're not making this up when we talk about that infection can trigger the formation of abnormal IgA in people who are genetically predisposed to it. So you can see that an infection in those patients can lead to this abnormal IgA that form an immune response that lead to the development of immune complexes that deposit in the kidneys, causing inflammation. All right, so moving on to the next study, and since we are talking about IgA nephropathy, let's talk about long-term outcomes for patients with IgA nephropathy. This recent study is published in CJASN and looked at long-term outcomes for patients with IgA nephropathy. It included 2299 adults, 140 children from the UK National Registry for Rare Kidney Diseases. 50% of these patients reached kidney failure or died over a median follow-up of 5.9 years. And the median kidney survival was 11.4 years. And the average age for kidney failure was 48 years old. Most patients, unfortunately, progressed to kidney failure in 10 to 15 years. The most important study result that I think the researchers were going after is that the time average proteinuria, the protein in urine, was significantly associated with worse kidney survival and rapid kidney function loss. Why is this important? It is important because beside knowing the natural progression of IgA nephropathy, many pharmaceutical companies are developing drugs for managing IgA nephropathy. They are targeting proteinuria. They're targeting the protein in the urine as a surrogate marker for the progression of kidney disease. So they want to show that elevated protein in the urine does implicate faster progression of kidney disease. You should know, though, that this study is sponsored by a pharmaceutical company that is the maker of a new IgA medication. And one of the authors actually worked for this pharmaceutical company, and others are consultant for it. Just leaving it out there for you. All right. Now, this final study looked at maternal risk factors and the risk of developing congenital abnormalities in the kidneys and urinary tract of their children. They found that overweight moms are more likely to have children with congenital abnormalities in the kidneys and urinary tract. The study looked at 4690 newborns enrolled between 2012 and 2020 in a hospital in Taiwan. And they compared maternal risk factors between children that had congenital abnormalities and children that did not have congenital abnormalities. In total, they find 73 cases of congenital abnormalities in the kidneys and urinary tract. And maternal overweight before pregnancy with a BMI more than 24 was an independent risk factors for development of congenital abnormalities in the kidneys and the urinary tract. And they actually did not see any association between pregestational diabetes or gestational diabetes and the formation of congenital abnormalities. So the researchers said maternal obesity before pregnancy was associated with these congenital abnormalities and should be addressed to ensure better outcome. So what this tells you, there is an important role of epigenetics in kidney health and disease. Not only that we have to think about our genes, we have to think about the environment that we live in and how it affects us and our children down the road. So I hope you like this video. If you like it, make sure you share it with people who may benefit from it. Don't forget to follow us on Instagram at Integrative Kidney, on Facebook at InKidney, and we're always on www.inkidney.com.